Hi, my name is Greg Felt, Director of Public Health in Sheffield. You may have heard that there are some considerations about Sheffield being put on the watch list or the areas of concern, more to the point. So we clocked an uptick in the 7-day incidence about 2 or 3 days ago. It's been going up for a while now. We've clocked that there was an increase in the positivity rate. Neither of those two things are trivial, but both are probably driven by two things. One, a large outbreak that we're aware of and are managing, but there were a significant number of positive cases as a result of that. Second one, we've clocked a very significant increase in the number of 20 to 25-year-olds testing positive. We've also pushed hard on enhanced testing, and we've been pushing testing, and we've dramatically increased our testing rates over the last couple of months. There's more to go out there, and we will keep on at that. So those are the reasons why we've been identified as on the areas of concern list. Overall, we still have the right strategy. What we'll be doing will be intensifying some of the interventions to keep pushing down at all opportunities and all places and spaces on reducing transmission. So the uptick in Sheffield, we've fluctuated over the last couple of months. There have been ups, there have been downs, there have been ups, there have been downs. It looks like this is the start of a more sustained up. That's happening nationally. No reason to think it would never happen here. We're aware of why. It's possible that the uptick is just a longer fluctuation. I don't think it is. If I had to guess it, it probably isn't, but I've been wrong on that one before. We've clocked that there's a shift away from COVID cases being predominantly in the Bayman community. That's not now the case. We've done the right thing in that way, and we've intervened in the right way there. We're seeing the same epidemiological picture as national. The average age of a case continues to fall, and as I've said before, at the moment hospital activity is almost zero, not quite zero, but certainly negligible. There is very, very little chance that we will be able to contain this in only working age, well people. Invariably, it will spread to older people. So we all have to be careful about how we do and don't encourage or amplify the transmission of the virus. So we will be, with all of our partners, working through how we intensify our interventions over the next couple of months. We know what works, minimising testing delay, the time between developing symptoms and getting a test, getting tested even if your symptoms are mild, optimising contact tracing coverage. There's still more we can do there, and minimising the tracing delay, and optimising isolation. We know that of the cases and their contacts who are recommended to isolate, we know that 4 out of 5 of people don't fully do that for a range of reasons. It's understandable, but if we want to reduce opportunities for transmission, that's the biggest one there. We will relook at the various set of preventive interventions that are potentially available to us. That probably will look at licensed premises. It may well look at open space and green space. We will provide as much support and information as we can to cafes, bars, restaurants, licensed trade. We'll certainly look at places where large numbers of people gather. We will have a fresh push on testing and community support for those that are being asked to isolate. We'll certainly be looking at how we can improve our contact tracing. Currently, we're working with NHS Test and Trace, and we've asked NHS Test and Trace to fund the City Council to enable us to really get into some of our communities where our outcomes aren't as good as they need to be. So we're working with the national stakeholders to do that. There are doubtless all sorts of messaging and comms angles that we haven't yet fully explored, or things that we haven't exploited. So we'll be looking at all sorts of interesting ways to continue to get the message across. The basic message will still be the same. Wash your hands, keep your distance, wear a face covering. Those things regrettably won't change, and there'll be no magic solutions. But we're a long way from lockdown, however that's described. It's up to us. We have to act in a way as a city to avoid an imposed lockdown, and only we can do that. So my ask for all of us is to, 1, stick with the programme, and 2, follow the guidelines. They're there for a reason, and they've served us well so far.